This is Kathy Knipfer, instructor for Nursing 2313, recording the Community-Based Nursing lecture for Chapter 5, Assessment of Individuals, Families, and Communities for Population-Based Care. Nursing process in the community-based settings is deliberate, adaptable, cyclic, client-focused, and an interactive process. It has a wider application to guide the care of individuals, families, and populations or communities. The basic construct is the same, though, with the assessment, diagnosis, outcomes, planning and intervention, as well as evaluation. Nursing process for care of the individual in community settings. Assessment provides a baseline to help evaluate the physiologic and psychological normality and functional capacity, and to identify environmental factors that may enhance or impair the individual's health status. The nurse must communicate effectively, observe systematically, and of course interpret data accurately. When using nursing process to care for the individual in a community setting, the client and family are in charge of nearly all aspects of care the majority of the time. The nurse is primarily a facilitator of self-care rather than solely a care provider. Delivery of care must be considered within the environment. Now let's review age-based nursing assessments in the community. For the infant and toddler, the nurse would assess and promote bonding. The nurse would also monitor growth and development and assess nutrition, as well as hearing, vision, and speech. The nurse should also assess for potential risk and harm. For the preschool child, school-age child, and adolescent, the nurse would take a health history and perform a physical. Height and weight would be assessed. The weight should be proportional to height. So you would make an assessment of obesity or the child being overweight. The nurse would also conduct a developmental evaluation and assess the home for safety. When assessing the adult or an elderly adult, the nurse would take a history and perform a physical. The nurse would also perform a functional assessment. The assessment tool or an example is on page 127. It's 5-2. Items that are assessed with a functional assessment include the environment, neurologic status, cognitive and emotional status, as well as integumentary status. These things can influence the client's functional ability. Please turn to the assessment tool 5-6 on page 135 for an example of an environmental assessment checklist. So with the environmental assessment, physiologic and survival needs are assessed, as well as safety and security, love and belonging, and family, friends, and pets. But within the physiologic and survival needs, you might assess fluid and foods and eating, elimination, hygiene, clothing, dressing, rest and sleep, medications and shelter. And then for safety, you would focus on mobility and fall prevention. You would also focus on fire and burn prevention, crime and injury prevention. For love and belonging, you would focus on the caregiver and communication. Family, friends, and pets, you would look at to see whether there were supportive neighbors and if their self-esteem and self-actualization needs are being met. The nurse would also assess activities of daily living as well as instrumental activities of daily living. And then the nurse would perform a nutrition screening. That would be on page 129, 5-3. This nutrition screening looks at food intake, weight loss, mobility, any psychological stress or disease, neuropsychological problems, and also the body mass index. The nurse would also perform a medication assessment. An example is on page 130 and 131, 5-4. The nurse would also perform a psychosocial assessment and a cultural assessment. You can refer to page 132, 5-5 for the cultural assessment guide. And we discussed that, when we discussed chapter 3. The spiritual assessment tool 5-7 is on page 137. You would ask questions like, Who or what provides the patient with strength and hope? How does the patient express their spirituality? What are the patient's spiritual goals? How does faith help the patient cope with illness? And there are other questions listed. It would be important for you to understand the types of questions that are on these individual assessment tools. Bright and Leahy describe a 15-minute family assessment. During this time, the nurse would establish trust through the use of basic therapeutic communication. The nurse would initiate and encourage family involvement in care. They would construct a genogram. The nurse would ask therapeutic questions and commend the individual and the family on their strengths. The nurse would also identify interventions to include in this family assessment. Some are listed on page 138, like inviting the families to accompany the client to the unit or the clinic or the hospital. Involve the family in the admission procedure or interview. Encourage the family to ask questions during the first visit or the orientation. Acknowledge the client and family's expertise in self-care or assisting in self-care. Ask about routines at home and incorporate them in the plan of care. Consult with clients and families about their ideas for treatment and discharge. Now we'll move on to population-based care and assessment of the community. This is done to determine available, accessible, and appropriate community resources for referral, determination of patterns of morbidity, and or community need for programs and services. Components include people, place, social systems, and social determinants of health. So what sources do we use for a population health assessment? We can use epidemiology, activities such as windshield surveys, where we assess people and places. We look at boundaries, the location of health services, housing, and the human-made environment. We look at social systems. We assess schools, parks, churches, public transportation, and availability of supermarkets. We can also use informant interviews with community leaders and people on the street. We can use participant observation, such as formal, which would be city council, and informal gatherings, like at a coffee shop. We can analyze existing data, such as the census, and then we can also construct specific surveys. Nursing process and population-based care. A community assessment may be accomplished by using any one or a combination of the methods listed. These methods are applied to the three dimensions of community: people, place, and social systems. One simple method of assessment is to use the characteristics of a healthy community. Another way to assess a community is to use an assessment guide with specific assessment questions. The Robert Wood Johnson Foundation has some recommendations, and we can develop related assessment questions. Once that information is collected, the nurse reviews it for repeating patterns that may appear. Problems or concerns and assets of the community are identified. The nursing diagnoses are more likely stated as a problem statement. The nurse should document the data that supports the problem and processes used to identify the problem. Common community nursing diagnoses or problems for population-based care are ineffective community coping, readiness for enhanced community coping, community contamination or risk for community contamination, ineffective community self-health management. An example would be community contamination as manifested by an unexpected increase in the rate of asthma among children over 3 decades. When using nursing process in population-based care, planning involves prioritizing community needs, establishing goals and objectives, and determining an action plan. Nursing interventions include community organizing, collaboration, advocacy, social marketing, policy development and enforcement, and coalition building. Evaluation compares expected outcomes with outcomes achieved within established time frames. Nursing process is always cyclical and continuous. Nurses can influence public policy. They are valued professionals whose input is often sought by those in the policymaking process. Through advocacy, social marketing, and education, the nurse may influence public opinion and healthcare public policy. In summary, nursing process is a tool that can be used to determine how people, place, and social systems influence health. Community assessment helps the nurse become aware of community problems that directly or indirectly affect the lives of clients and their families. The role of the nurse in community assessment will continue to remain important for the health of communities. Question number 1. The main components of a functional assessment include which of the following? A. Eating habits, environmental factors, respiratory status, and age. B. Environmental assessment, neurologic status, cognitive and emotional status, integumentary status, and respiratory status. C. Perceptual function, sensory function, and nutritional status. Or D. Gender, cultural and spiritual factors, and emotional status. The answer is B. Environmental assessment, neurologic status, cognitive and emotional status, integumentary status, and respiratory status. The rationale is that the functional assessment requires the nurse to determine whether there are environmental, cognitive, neurologic, or behavioral barriers to independent function and self-care. The primary consideration of the functional assessment is whether the client needs the assistance of another person for daily function. Question number 2. You are a nurse in a pediatric clinic. You just moved from one state to another, and there seem to be many more children who have asthma here than where you worked before. You consult with a school nurse, and he tells you that in the last decade, the number of children with asthma has increased dramatically in the school district. This is an example of which method of community assessment? A. Windshield survey. B. Participant observation. C. Key informant. Or D. Secondary data. The answer is C. Key informant. The rationale is that informant interviews involve community residents who are either key informants or members of the general public. Key informants are individuals in positions of power or influence in the community, such as leaders in local government, schools, and the religious or business community.